Sir, shall I start?
Yes, you may start, sir.
पृथिव्यां त्रीणि रत्नानि जलम् अन्नं सुभाषितं मूढैः पाषाण खण्डेषु रत्नसंज्ञा विधीयते. Good morning, distinguished guests, participants, and viewers of the webinar. It's my proud moment to extend my warm wishes on behalf of Soundarya Institute of Management and Science, Bangalore. It's my immense pleasure and privilege to convey my heartfelt gratitude and welcome to our chief guest for the day, Dr. Geetha Appachu, Madam. Madam, heartily welcome, Madam.
Thank you.
I sincerely welcome Mr. Kirtan Kumar M, Chief Executive Officer of Soundarya Institute of Management and Science. My heartfelt welcome to our beloved Principal, Dr. Suresh C. Hegde, sir, IQAC Coordinator, Shri Shivakumar U. Ganachari, sir, and the head of the various departments, Professor Prithvi Hegde, Professor Girish, and Professor Kaushik, and all my dear colleagues and friends. We all know that since 2019, we have been facing a serious and very dangerous, I can use the dangerous pandemic situations, not only in India, across the world. The greatest wealth is health. We know very well, Arogyave Bhagya. This pandemic has taught a very good lesson, all of us. It's always true that keep ourselves healthy, one needs to keep his, her mental health in healthy condition along with physical health. In modern era, the lifestyle is becoming so hectic that everyone is running behind the money, name, fame, etc. Nobody is thinking about peace, prosperity, and happiness, but everybody wants peace, prosperity, happiness. The question is where we can find the peace, prosperity. Is it available in the market? Absolutely no. Peace, prosperity is inside the body. Only we need to recognize and understand how to handle stress properly with the help of psychologists through counseling. So all of us are facing problems and situations in life, especially in COVID-19 pandemic, and we need to overcome all those and deserve success, and most importantly, to get the peace, prosperity, and happiness. So the main purpose of today's webinar is that why is living in a healthy mind and body? I'll repeat, why is living in a healthy mind and body? We, the Soundarya Institute of Management and Science, with the collaboration of Swapreran, a psychological wellness center, Bangalore, are here to help and guide you through the psychological approach towards pandemic through this webinar. It's my immense pleasure. I introduce the today's guest speaker, I. Lokesh Angadi, Assistant Professor, Department of Commerce. Feel proud and honored to introduce the today's chief guest for the day. Dr. Geetha Appachu Madam is an established psychologist with more than 15 years of teaching and clinical experience. She is a chief head of Swapreran, Psychology Wellness Center in Bangalore. Dr. Geetha Appachu Madam holds a doctoral degree in psychology and 2 doctoral research works collaborating with University in Norway and Canada. It's my honor for you, Madam. Madam has been conducted and developed training programs for established corporates and organizations like HP, GMR groups, KSRTC, BMTC, and more than a dozen schools and colleges. She has a rich experience in mentoring and guiding psychology to medical students, many graduates, postgraduates, and even Ph.D. scholars also. Madam has helped numerous people of all the age groups to help them to overcome psychological imbalance and helping with courage to adjust to situations of life, especially in COVID-19 pandemic situations. Madam is not only a psychotherapist, not only a psychologist, but also a motivational speaker and competent trainer such as stress management skills, awareness programs in hospitals and corporate setups with psychological issues. Dr. Geetha Appachu Madam has been regarded one of the best psychology counselor in Bangalore. It's our privilege, Madam, to with you. It's an incredible honor for us to have Dr. Geetha Appachu Madam in our midst as an invited speaker for our special webinar during this time of pandemic. I once again warm welcome to you, Dr. Geetha Appachu Madam, to this wonderful webinar. Now, without any delay, I would jump on to the topic of the today's webinar, psychological approach towards pandemic. Over to Dr. Appachu Madam. Over to you, ma'am. Thank you very much.
Namaskar. My name is Dr. Geetha Appachu. So
Yeah.
there's no Ranjan or anything there.
Yeah, yes, yeah, ma'am.
Yes. At the outset, I would actually want to thank Soundarya Institute of Management and Science. In fact, the principal, the head of the department, Mr. Girish, Mr. Lokesh, and each and every faculty member who believes that today, through online platform, it is required not just for online classes, but also for, refreshing something in the mind. And let us see if this attempt can be a good one today. The topic for today that I thought I can have for the August gathering is mental health during this second wave of COVID-19 pandemic. We will look into both mental health and mental hygiene. So, so much, right from, I think, our LKG, we have always discussed about hygiene. And today, hygiene has become one of the key necessities for us. Have we neglected hygiene? What is this, pandemic? And yes, like Mr. Lokesh was just introducing and talking initially, that it has been a year plus now that we have been experiencing various issues related to the pandemic. The pandemic, the virus is one, but then what we have been experiencing is enormous. Being involved in client mental health and hygiene care, as well as, of course, training and coaching in different aspects of life skills for the past 28 years now, I have found that in this past 1 year, there has been this need for, discussing what should be our mental health and hygiene in different forums, especially when there is this pandemic, which is bringing about a new normal. You'll all agree that now we are all in a social structure, which is essentially a new normal. So starting with infrastructural change that happens, which is involving a lot of us to do psychological coping, what we have is, we have for the past 1 year, a lot of change. Are we all not sitting at home within the four walls? Are we all not adapting to the new normal? Well, we are. You'll all agree with me, students, faculty members, that we're all very evolving and developing human beings, right? We adapt quickly to the new normal. And then after a small period of discomfort, you'll agree that we do an amazing bit from our side to adapt. See, before we even start discussing, the pandemic and so much is happening because of the pandemic, can we just look at what development and technology has given us? It has given us amazing infrastructure. Will you all agree that we've all learned, for example, to adapt to use seat belts while driving fast cars? We've become very comfortable now. This is a new adaptation, right? Well, on very well-laid roads across our country, there's several roads, which is like amazing, but then don't we follow speed limits here? All of these are different adaptations that we've been making. You'll agree with me, right? We adapt, and this is so much required. So the second wave has seen and recorded unexpected rise in this COVID-19 treated people. We agree that the second wave has been more difficult, and that's what most surveys have been saying and mentioning. Most people are expressing distress not able to accept the chaos. There is so much of stress experience. Well, stress experience is inevitable. You'll agree with me. There is spike in anger levels in most of us, frustration, and a lot of feelings. It's very important for us today in this precious time that we all have come together as a forum to find out and identify what will help us better understand the psychological mechanism of fear, anxiety, and depression in this COVID-19 pandemic era. Let's make some guidelines for ourselves. That will be even better. And if we all have to understand that there is a lot of research that has started right from the time this pandemic was, introduced as a big threat to the world. The world of research has been trying to understand in the field of mental health, what is it that is happening within individuals. The first most important thing that we have to understand is that a lot of research has been indicating that younger individuals are showing greater fear and anxiety responses to this second wave. In fact, this is across the globe, right? I'm not just discussing India, it's across the globe. This is something that is happening. Well, during this second wave period, we can expect to have a lot of mixed feelings, right? It's natural for us to feel anxious. This much, I think we all have to admit. Also have doubts and fear as we hear new headlines. Almost every day, there is a bombardment of newer news items that comes into our fold as we wake up. Today, I will attempt to discuss doing only what matters to us, what matters to us in this new normal, remembering that we can take practical steps. So here, that is why I keep repeating, only what matters to us. You will agree that in this time of uncertainty of the present and future that is affecting all of us, this mental illness can be very beautifully supported. What is this impact that it is doing? Well, there is impact on the physical health of ourselves as well as loved ones. There's impact on work and productivity. And also several such concerns is what is coming out in various forums. I suggest that first, let us all make a list of what is in my control. I'll repeat, a list of what is in my control. Another list of what is not in my control. Can we do that? So, two lists, a list of what is in my control and another list of what is not in my control. Well, I'll also suggest a tip. Do this by focusing on your here and now. That means your today. So why am I emphasizing on today? You'll all agree with me. Whenever we discuss fear, anxiety, and anybody will ask you, why is this fear for? What is happening? Why is this fear for? Then you will understand that most of us talk about future, right? So today we'll make an attempt of focusing on our here and now. As we make this list of what is in my control, another list, what is not in my control. Try this. You will find that the mind is so much at ease. so comforted when we are sure that we are following all the safety protocols, maintaining COVID appropriate behavior, right? This is the first thing that we need to do. And you will find that there is so much of self assurance that starts coming in when we know that we are following the protocols. We know that we are abiding with the COVID appropriate behavior. So then, what is it that we are focusing on? We are focusing on how do we have a day which is so much in my control. So you'll all start beginning to feel optimistic, when you start your day. And how do we have a better way to starting it? The first thing is, let's all devote time to strengthening our body and mind. So for the body, of course, today there is so much available through this, again, beautiful source of social media. And this physical exercise, today we know, is so much required to develop better lung capacity, to develop better functioning of our immune system too. In this everyday schedule, please remember to indulge also in a guided relaxation hour. This is for the mind, right? And also, I will insist adequate amount of rest. I have been hearing a lot of my clients, especially parents, talking about how their children have not been having adequate rest. And why is it happening? I believe it is happening because there is no going away to school, going out to college. And so children have even forgotten the right time to go to bed. I believe gadget addiction is also happening. So now when we talk about, can we have an everyday schedule? So it has to be a well-organized one. You'll agree with me that when we decide on time for physical health, let us also have some time for our mind to relax. Several guided relaxation techniques are available. Let's use whatever we can. Another suggestion here is that there is an overloading of information, right? So the thing is that instead of becoming very overwhelmed with what should I do, how should I use, which is best, well, we have ample time now. Why should we even complain of slow down? Hey, I was enjoying a fast-paced life. Now I'm within the four walls. Oh, let's start using this beautiful opportunity to actually do one thing each day out of this big variety, instead of calling it an overload, instead of calling it a bombardment of what our social media can give us. I will say that there is so much to choose. So why not we be very happy with that? Here, my tip to one and all is, we can use this global slowdown to advantage our mind. And of course, not overloading ourselves with health benefits. There is so much across the media, but let us feel reassured and satisfied with what we have chosen to do today, right? I was emphasizing on today. So today for ourselves, again, that here and now experience that I was talking about. I repeat, guide yourself to live, to enjoy, and to trust your body and mind today. This technique of making a beautifully planned today will become a habit. That is what I was aiming at. Can I introduce this to the august gathering of students and adults and everyone? In fact, let this message just go that can we make beautiful habits out of keeping in mind our written and convinced list of what is in my control. You remember we had discussed about that list a while ago. So keeping in mind that written aspect and a convinced list, we have to be very convinced. Our mind has to be first convinced with what is in my control. I want to emphasize that let us start learning the art of developing self-responsibilities. We have to start this if we do not have. If we have been always constantly depending on our external environment, then instead of complaining, because I don't have school and college, so I have become a gadget addict. When I was going to college, I was better disciplined. No, let us take self-responsibility. See, this responsibility is just for our today. And then this today can become a beautiful habit. So that is where my focus is in asking you all to join this art of developing self-responsibilities. Our mental health and hygiene can each day get rejuvenated as much as our physical health by taking the self-responsibility to address and work with what is specifically troubling us. You know, so then what will happen is you will be able to actually pinpoint today what is bothering me, right? Self-responsibility to both doing what is in my control and also taking help to connect with a psychologist. I must say that please remember to take support for your mental well-being also. I think today we have started becoming very paranoid with the first incident of some irritation in the throat, the first incident of some kind of a body ache. It is very good that we need to start becoming aware, but we should not become extremely paranoid. We should not become overindulgent in actually exaggerating any symptom. And do you know that this habit of self-responsibility is something that will actually help us to get to what is specifically bothering me today, right? I hope I am able to get across what I'm trying to tell you about what is mental hygiene. In fact, when the organizers were asking me that can we have a 1 hour program of a webinar, so I was just trying to indicate that online training of 1 hour itself becomes too much. It becomes very overbearing for any mind to sit and to constantly listen and process. So trust me, friends, for all those who have joined this forum today, it is not going to be a 1 hour or a very long program. I want you all to just understand that based on what tips I'm discussing here, and based on how much you're able to understand, I want you to, in fact, ask more questions. And that way, probably, the time that we are spending together can be more resourceful for both of us, you as well as this August gathering of people from everywhere who are connecting for this webinar today. So I was talking about self-responsibility. This habit of self-responsibility of creating a beautiful today will also remove an old habit. Which habit am I talking about? You know, in some of us, we have the habit of pushing a thought laden with fear or anxiety or feeling low under the carpet. Most of us do that. आमेले note करना, देखा जाएगा, बाद में देखा जाएगा. So let us remember we should always be so responsible and aware that we should not push these kinds of thoughts related to fear and anxiety under the carpet. Let's stay physically and mentally busy And when I'm talking about this particular tip of staying physically and mentally busy, I will suggest that only with your set priorities of the day. You remember again that list that I was talking about? A list of priorities or tasks which we can do and which is within our control, right? Remember, there is a big difference in recognizing signs and symptoms, what we are experiencing, and also when we plan to take appropriate support for it. This both is equally important. One is to recognize, and also when we plan to take appropriate support. It's very required that we do both as responsibility for ourselves. What I mentioned about being self-responsible will guide you to take appropriate support, but not exaggerate any symptom. I hope you're able to get that clear. So keeping ourselves busy is only in that much of positive planning of our today. That's all. Positive planning of our day is now dependent on two very important things. So this positive planning is dependent, one, on motivation. This, I think you should always remember that this necessary amount of motivation is required for positive planning. Along with motivation, another very important thing is right knowledge. So whenever we talk about motivation, yes, we have beautiful family system in our society. Whether we live together or we live, across places, we connect. Thanks to technology, we connect, and we connect to motivate. Motivation and the right knowledge, both of this can definitely help us in planning a positive today. Why am I emphasizing on just today? Remember that whenever there is worry, whenever there is anxiety, you will find that our thoughts are speeding towards the future. And what is it based on? Some negative experience of the past. Can we do anything about it? If I ask all of you this question, what will be the answer? Actually, there's nothing that we can do, right? So while one big group in the society is thinking about how do I cope with so many things, so many changes has happened, be it financial changes, and be it, change in my lifestyle because of the pandemic. What we have to understand is whether we have become financially strong in the past, whether we had an amazing, fast-paced life in the past. Today, what is in our control? Just living a very healthy, both mentally and physically healthy life, and we're discussing just today. Well, remember, knowledge, the right knowledge, or knowledge from the appropriate source, along with the required amount of motivation, can bring about an amazing, beautiful today. Try it. It is definitely something that you can achieve. Well, there is no one single magical answer for families, living together, maintaining relationships, because we all differ. Our family structures differ. We as individuals, we differ. And today, what is the scenario? We're all working from home. In the lockdown scenario, we're all working from home. And so here, my suggestion will be, if every member in a family, each and every member has a well-planned, organized daily routine. It will lead to less chaos in the mind throughout the day. In fact, in this 1 year, I have been even suggesting to parents that have a beautiful, wonderful routine for your little ones, right? Parents have started feeling this enormous pressure of children being indoors all the time. Well, we all understand that it has been a new normal. But, you know, my suggestion is that if every member has a well-planned, organized daily routine, then it will lead to less chaos in the mind, right? Let's try that. So I'm really thinking that you'll take these tips, try. Then, we can always wonder that, hey, does this work for me or not? So we need to take the self-responsibility to try. Remember, also one more thing, very important. There is also something like having appropriate worry about prioritizing, working on several things in our day. This is normal, right? This appropriate worry is like, for example, I'm sure all of us were getting ready in order to, come in at the right time so that we can start the webinar at the right time, right? There is some amount of anxiety, even when we are worrying to be on time. And that was something, a priority that we have done in the past 1 hour or 2 hours. This anxiety actually is good. It will drive us to work better. But if anybody is experiencing a pattern of hopelessness, this is different. I want all of you to understand that I'm talking about something very different, a pattern of hopelessness. Then please connect with the psychologist. I will repeat that please do not push such feelings under the carpet. This feeling can be worked with. And also remember that when you work with this, you will help it pass. Please do not wait. Please do not wait for, wasting days and weeks. Please try to address this. This is a very different feeling and do not neglect it. If most of us, young adults, have been living in a very, fast-paced, speed-moving bubble, I call it a bubble, actually, what we had in the past, let us say, 5 to 10 years. What were we all experiencing? Erratic sleep hours, erratic food habits. Most of us, I'm not saying all. Several other addictions, excess of travel, and of course, excess of socialization for some of us. And for most of us also, unplanned work schedule. So now, has this big group who have been part of that bubble that I was describing, is there this feeling that the whole world has collapsed at your feet? Is such a feeling there? I wish to indicate to one and all who have this experience that it's now the most appropriate time to become aware. This self-awareness is necessary to recognize signs and the symptoms of hopelessness in the new normal. So, like I said, that some amount of fear, some amount of anxiety, some amount of sadness for not being able to be like before is okay, because I know that all of us have beautiful coping mechanisms, like especially when we start planning a good day, a beautiful day. This will pass. but that hopelessness in the new normal is something we need to work. And then, very importantly, if we start adapting to this new changes that our work life, work culture has brought, the new changes within the family has brought, some amount of illness most of us have experienced. Most of us have experienced this. Also, there has been, several deaths of loved ones. Let us not start attributing it to the doom of the pandemic. Taking stock at a personal level is very required. Please remember, friends, we need to take stock at a personal level. Our thoughts, behaviors, and response patterns, the way we respond during this pandemic, during this lockdown, whether is this an individual trend, or let us try and understand that is it across the globe, the situations that is indicating of a collective trauma, whatever it is. The question is, do I like this constant discomfort? We are experiencing the discomfort. Where is it being created? Within us. So then who takes this responsibility? Yes, it is me. The discomfort I have started. Do I like this constant discomfort? Then what kind of discomforts? Let's take any example. Having too many arguments. Is it happening in most homes? Throwing tantrums? Well, I will also want to tell, and in the support of youngsters, that it's not just children who throw tantrums. Even adults can throw tantrums, right? All living together for so many months. Well, the whole point is that in these response patterns, in this behavior of ours, are we experiencing discomfort? We don't like it, right? That is when we say we are experiencing discomfort. And then, do we like this discomfort? The answer from everybody is no, I don't like this discomfort. Then, this is the right time where you'll agree with me that you're ready to motivate yourself to live a better today in the new normal, right? Let us stop destructive, unhealthy beliefs about ourselves. This is something which we all need to do. Remember, it is okay to be sad, have some fears, okay. Then work on them with knowledge, gain new awareness. Well, please take help for developing better mental hygiene. Please, let's do that, all of us. When we need it, we need to take help. This is all because we need to develop healthy beliefs. Well, young minds, as well as everyone who is listening, can we all start our day well? The word well is as much as you want to add to the experience of feeling good. I always train my clients, who connect with me, not just in this past 1 year, the pandemic, the new normal. I will say that in the past 2 decades, so much has changed. Our society has evolved, right? Behavior patterns and everything has been constantly changing. I always train my clients to pick up any technique that they are comfortable to adapt, So it cannot be something that the professional, as a mentor, as a psychologist, I can push something which I believe is good. You can pick up any technique that is comfortable for you to adapt. But the technique to have a positive today, a technique to adapt to this new normal, a technique which will help you to, overcome those feeling of anxiety. I would suggest plan your day so that you can, send both your mind and body, send both your mind and body to sleep well at the end of the day, because that also matters, isn't it? So we start our day well, we end it by having a good night's rest. What else do we believe is good for us? The mantra today then will be one day at a time. Will you all agree with me that one day at a time with simple mental hygiene steps? As much as we care for our physical hygiene, our body hygiene, the mental hygiene is also something that is equally required and equally an important self-responsibility for us. I will actually end by saying your body can stand almost anything. You'll all agree with me, friends, that world records have been set. Eating glass, eating tube lights, moving a plane, moving a train, moving a loaded truck with just hair, with teeth, or, with somebody's neck or back. So body can stand almost anything. It's your mind that you need to convince. You have to convince. Please take care of your body. It's the only place you have to live. You have to breathe well, and that is experiencing life. Remember, mind matters. Thank you so much for listening. Thank you, the organizers, for planning such a program for one and all, because I never miss a single opportunity which helps me to connect with people and explain to them that mind matters. Thank you.
Yes, madam. Thank you very much, Dr. Geetha Appachu, madam. Thank you very much for this very fantastic and fabulous session. Madam, we have many questions because more than 300 participants, they have already in online in the live session. Many students, they ask the question, but I'm going to ask you very few. Okay. The first question is like, first question is like this, madam. How to be control over emotions at thought times? This is the question asked by Mr. Ashok. How to be control over emotions at thought times? I mean, whenever you are thinking, when you are thought times, whenever you are thinking, no, then how to control our emotions during thinking time? Yeah.
All right. So then I will have a question for Mr. Ashok, that are your emotions balanced when you are responding? See, we all go through two processes. One is we are thinking, then whatever we are thinking, we are also responding. We are interacting with people. So my doubt is that, are you able to balance your emotions when you are interacting with people? And are you having this difficulty of, not balancing your emotions when you are in your thoughts? Then it is a specific question for a specific person. So it cannot be a generic answer, but I have one good thing to say. Find out that if you are able to balance your emotions when you are interacting with others, then you have no problem. Then is it that you're bottling your emotion? For example, you are full of anger, but you're looking at, your boss or somebody, and you're being very nice. But your thoughts is where you're having the difficulty with this emotion. What is the emotion? Anger. So here, what I will want to explain is that the first step is to care for yourself. I was talking about taking self-responsibility, being aware of. So we have to first learn to balance our emotions within, right? Because it is harming us. And so, what is the technique, if you ask? It is something which you should be able to adapt. So if it is for Ashok, if it is for X, it is for Y, it is for Z, the technique is different. But please do not constantly bottle your emotions, is what I will say, because this brings about any kind of illness, not mental illness. It brings about physiological illness. Today, associate with, be it heart condition, be it lung condition, any organ of the body, you will understand that this balance of emotion is required. And when we don't do it, that is when we suffer. So, like I made two very important points about we'll need to live in this body. Let us, care for it. And that care starts with when you know how to balance your emotions for your own self, right? So I hope you were able to get that. I was asking you to start thinking about where is the problem. Only when you are with yourself, that is in your thoughts, but you're able to do well with others, then find out whether that is true. You're really doing well, or you are actually just faking it. Faking it means putting a lot of pressure on yourself, bottling up that emotion. Let that not happen.
Yes, thank you, madam. Thank you, madam, and Mr. Ashok. Such a wonderful question. The thoughts are manifestation, right, ma'am? Jaisa sochenge, vaisa banenge. That is what I remember. And one more question, madam. This is from Hanumant Mentakari, our English professor, is my colleague. He's asking the one question: to what extent does the mental health impact physical health and vice versa?
Okay. Thank you, sir, for this question. And I hope through this question from you, I'm sure whether it was a question or it was to bring about awareness to the entire student population of your institution, trust me, every bit of our mental health and hygiene is what makes our physiological health. Not to what extent, to how much level, there is no measurement. Every bit of what we are in our body is because of the way we pattern our mind. So I will say that every bit of our mental health influences our physiological health or body.
Yeah, thank you, madam. And last one question, madam. Just I don't want to consume your valuable time. Okay, just one more question. Professor Girish, he is a HOD of our business department. His question is like this: how to stop the phobia or fear that's spreading along with the coronavirus?
Okay. I don't know how much of the virus is spreading, but
Yes.
the amazing mind and the speed at which this amazing, magnificent creator has created this mind, this beautiful mind, you can either drive away the fear or you can create more and more fear. The choice is yours. So the question is that about phobia, right? Now,
Yes,
when we use the word phobia, then it is an exaggerated fear. It is in a bad level. But when we are discussing fear, then it can be very nicely taken care of with the right knowledge, with the right amount of awareness. Like in my talk today, I was asking everyone that if you are having COVID appropriate behavior, following protocols, then the fears must reduce that I'm taking good care of myself so that I should not get affected by the virus. So when we are doing that at a body level, then the fear in the mind automatically reduces.
Yes, thank you very much, madam. Actually, many questions what we have, but I don't want to consume our valuable time. Madam, this is a wonderful class today. And this just like it came to my mind, we are in this modern era, we are physically ill, mentally nil, morally not so well. So this is what I came to my mind. I think fantastic session, madam. Really, I thankful behalf of my institutions and behalf of me. Now I over to Madam Swati, Assistant Professor, Department of Commerce. Swati, madam.
Yes, sir.
Yeah, go ahead.
Yeah, thank you, sir. Good afternoon to one and all. I deem it's a great honor and privilege to propose the vote of thanks on this occasion. First and foremost, I would like to thank our webinar speaker, Dr. Geetha Appachu, for enlightening us with her knowledge. Today's webinar was full of knowledge and we gained a lot more information about the psychological facts towards our pandemic. Thank you, ma'am, for your words of wisdom and thank you so much for enlightening us.
Thank you.
I thank our respected CEO, Mr. Ketan Kumar, sir, who graced us with his presence and guidance. Thank you, sir. We have been fortunate to be assisted by our principal, Dr. Suresh C. Hegadi, sir. You have been a constant support and you have given us a lot of encouragement. Thank you, sir. My heartfelt thanks to all the heads of various departments and the faculty members for their valuable contribution, guidance, and encouragement. Thank you all. Last but not the least, I thank all the participants for your cooperation in making this webinar a resounding success. Thank you, one and all. Thank you, sir.
Thank you very much, madam. Thank you, madam. Shall I wind up the session, madam? Thank you very